Hey guys, Dr. Ben here at the Functional Medicine Center of Fort Collins, and today I'm going to go over something that I've been seeing a whole lot in practice, and this is fatty liver. And what we see is actually non-alcoholic fatty liver. In the old days, what was fatty liver from? Well, that was from people drinking too much, right? Well, a couple things. One, I don't see a lot of people that are drinking lots and lots in the practice. If somebody's drinking 6-8 beers a day, a lot of times they're not really looking to go down the path of truly healing their body and doing those things. 1, 2, 3 drinks a night is not going to cause fatty liver for the vast majority of people. So if somebody, they'll come in and they'll say, oh, I'm having 1 glass of wine, 2, maybe sometimes 3 glasses of wine a few nights a week or whatever. You know, it's probably not great, and there's probably reasons why they're doing that, trying to calm down the brain, trying to calm down their anxiety, some things like that. But ultimately, we've got to figure out that underlying why that somebody's getting this fatty liver. So if it's not alcohol, what is it? Well, the big thing that we see is blood sugar imbalances, and it's actually, most people think, oh, you're diabetic, you get fatty liver. Well, we see way more non-diabetics with fatty liver than, or non-diabetics with fatty liver than diabetics with fatty liver. And here's the reason why. I'm going to show you what happens here. If this is our blood sugar, non-fasting blood sugar, we want 85 to 110. If that non-fasting blood sugar is swinging, which the vast majority of people doing the standard American diet, they're doing this, up and down, and they will feel these symptoms. They will feel up here, we're going to get inflammation, and that can be joint inflammation, that can be brain inflammation, a lot of different things. Neurological issues, they call Alzheimer's type 3 diabetes. It's going to cause brain inflammation, brain fog, a lot of different things. If somebody has autoimmune conditions, every time that blood sugar spikes up too high, it's going to cause this inflammatory cascade that's going to destroy more tissue. People that are having a hard time losing weight, a lot of times because that blood sugar is going up. When we go down blood sugar, we get tired, we get spacey, and everybody's favorite, hangry. You'd be amazed how many times in this last couple of weeks people have said, oh, hangry, I live there. They're basically there all the time. So tired, spacey, hangry, highs and lows are both going to stimulate autoimmunity. So if somebody has an autoimmune condition going on, we've got to get them stabilized into that good range. So from there we look at, okay, well, what does this have to do with the liver? The first place that we go when we use glucose is into our cells. The second place we go is we store it in the liver for short-term storage. And the third place we go is into fat storage. So that's why eating carbs, glucose, all that can make us fat. So we've got our cell, we've got the liver, and we've got fat. And liver, every time that blood sugar goes low, the liver is stimulated to kick out immediate stores of glucose. And so what does that mean? Every time that blood sugar goes up too high or down too low, we're asking the liver to store glucose, release glucose, store it, release it, store it, release it, over and over and over again. And eventually what will happen is we start getting fatty liver. Fatty liver, we're not going to detoxify as well, we're not going to be able to stabilize our blood sugar, we're not going to be able to regulate our hormones like we need to. A lot of negative things are going to start happening with that fatty liver. But the great part is this is totally reversible. The liver is a great organ to repair and regenerate because it can do those things and very quickly. If I needed a liver transplant and you had a liver that I would want, I could take half your liver and it would grow inside of me and yours would grow back. That's how cool the liver is. So the liver can repair. We look for fatty liver in almost everyone. That is the marker GGT. Unfortunately, most routine lab panels do not run the GGT, and most people do not know if they have a fatty liver. But we see it probably at least 10 to 20% of the time we're seeing fatty liver in patients. So this is reversible. There's a lot of things that can be done, but the first place is to start stabilizing that blood sugar. Like or share this if anybody you know is dealing with blood sugar imbalances, fatty liver, issues that we may be able to help them. We love getting the word out, and if you have any questions, go ahead and put it down in the comment section below, and we'd love to hear from you with any info that you've got coming in. So have a great day, and we'll see you guys soon.